We shall start. So hi everyone, thank you to those who are external to the project for joining us today. My name is Ruth and I have been the project manager for the Theatre in Education Research Project with East Sussex County Council. We are here today to speak about that project and to launch a guide for commissioners and educators around the use of theatre in education to support PSHE. Couple of housekeeping notes before we kick off properly. The meeting is being recorded for those who aren't able to attend right now and who might want to watch later. You will see that your microphones and cameras are turned off as a feature of kind of entering the meeting, but do indicate to us in the chat if you want to ask a question when it comes to the question time, or need to have that status changed for any reason. We will have, or we hope to have 10 or 15 minutes for questions after presentations. If you want to say anything in the meantime, please use the chat function and we'll come back to that. Yeah, and so now I shall introduce you to our four speakers. Over here, we have got firstly David Bishop, who is the Health Improvement Principal within East Sussex County Council, followed by Sam Whitaker, Assistant Head Teacher at Seaford Head School, as well as PSHE Hub Lead within East Sussex and Safeguarding Consultant for the Council, so wearing several hats joining us today. We also have Jörg Huber, who is a Professor of Health Sciences at the University of Brighton, and Dr. Carmen Colclough, who's been the Research Fellow for this project from the University of Brighton. The format of today is going to be a bit of a question and answer, with each of those speakers having prepared some slides in advance. So I shall be facilitating as we go through, and we'll also have a short film embedded in the webinar. So firstly, I will turn to David to ask you, what is this theatre in education that we're talking about, and how has it been used across East Sussex?
Yes, welcome everyone. So theatre education, it integrates live drama with educational aims, essentially. It's inviting audiences to reflect on social issues through character-driven narratives, emotional identification and collective discussion about the issues raised. The slide for me hasn't moved on. Is it moved on for you?
Here we are. There you go. Yeah, sorry.
There we go, thank you. So it originates in the UK in the 1960s in Coventry Belgrade Theatre. You know, they created a theatre and education company, which has claimed to be the founding movement of the theatre and education movement. And there are different forms of theatre education with varying levels of participation and engagement of the audience or of the intended target groups within the production itself. So today what we're talking about is theatre education largely delivered through professional theatre companies combined with classroom activities. So theatre education has been used within health promotion on various different topics ranging from sexual health, social health and substance use as well. So the thinking really is that this arts-based format can facilitate experiential learning, evoking empathy and enabling audiences to kind of rehearse choices that they might make in real life in a really imaginative space. So some reviews have shown that kind of drama-based programs have the potential to enhance knowledge and influence attitudes, but kind of evidence is a bit mixed around whether it's just the short-term impacts that it might have, and we really need to learn more about what might actually work, the things that haven't been yet fully explored. Because we really want to also kind of explain how the aesthetic and social process of theatre and experiencing theatre could help potentially generate change. So the effectiveness of theatre education might not depend just on the message content, but also the composition of the the school culture, the performance environment, how credible actors are, and all, so on and so forth. So there remains kind of a need to unpack these processes and find out what works. Can move on to the next slide, please. So how have we used theatre and education in East Sussex? We've, since about 2019, commissioned a series of multi-component theatre and education packages on various issues that impact on young people's lives, delivered in secondary schools and selected special schools. So it's really been seen as a preventative approach to seek to tackle those issues around health and well-being and safeguarding themes. So it's been collaborations between public health, children's services, and also the Sussex Police and Crime Commissioner's Office for certain topics that have led to development of our programme. And we've had the backing of the local Children's Safeguarding Partnership and other partners in what we've been doing. So schools have very much welcomed this support, and it complements their personal, social, health and economic education delivery. And we've had all secondary schools in the area take up this offer. So the aspiration has really been to provide a consistent offer that supports schools in their delivery of high quality PSHE and helps them to meet or exceed the statutory guidance on relationships education, sex education and health education. And we've currently got a regular programme of 2 packages per year, one on drugs, alcohol and tobacco education, including vaping, and another on healthy relationships and harmful sexual behaviours. And those priorities have been informed by what pupils, teachers and other data tells us is needed for now. So, for example, the theatre education packages that we've done research on, which this guide that we're going to introduce in a moment is based on, is around the drugs, alcohol and tobacco education theme. And we're really wanting to help young people to understand facts, law and risks and consequences associated with alcohol and other drug use, and the health outcomes and impact on relationships. So enabling young people to manage and influence those the influences and pressures, and focus on early prevention and harm minimisation. So helping people to make those informed choices about alcohol use and building awareness. And this has been delivered as part of a wider package of support that the Council offers as part of a whole school approach to health improvement, including a healthy schools approach, supporting healthy policies and practice within schools, and also wider PSHE support provision through our PSHE hubs, where lead schools offer kind of school-to-school support through a grant that we provide to provide learning and resources to schools in their areas. Okay, next slide. So yes, we're today launching our guide, practical guide for commissioners and educators, that's been compiled based on this experience that we've had of delivering theatre and education in East Sussex, and also informed by a research project that we'll be telling you more about in a moment, that we've completed over the last year. So it's intended to support other areas who may be interested in developing their own programmes with what we hope are helpful tips and pointers on how to achieve an impactful programme. And it covers the things listed there, which we'll be going into more detail on today.
Great, thank you. A great segue then into talking a bit about how this all aligns with PSHE. Sam, can you tell us a bit about that? How does theatre and education align with PSHE in schools, and especially this focus on drugs and alcohol?
Yeah, thank you, Ruth. So I think it's really important to note that the first point there shown on the slides, that it's really critical that theatre and education isn't just delivered as a standalone kind of one assembly, one-off part of our young people's drugs education. So it should be part of a spiral curriculum approach where children and young people have received drugs, tobacco and alcohol education kind of consistently throughout their schooling. And this we recommend about Key Stage 4 we've sent out to our schools, so kind of the year 9, year 10, depending on cohort, and it should align with other kind of lessons and other delivery that we provide our young people. So it's definitely not a case of here's the theatre for an hour and then they're going to go away and then the drugs education is done for a year. That's something we've made really, really clear to our schools. So as part of that, we have provided a series of lessons for them to deliver around that and obviously encourage that whole school approach. What it does do kind of on the ground in terms of a school perspective is that it gives that variety in delivery. So the young people, when we survey them, are obviously engaged in our lessons, depending on their teacher. The specialised teachers can give really positive and critical information for them, drip feeding over their time in schools. But to hear the information from other external professionals helps kind of bring it home. Especially in this theatre performance, which is really engaging for the young people to look at some of the issues we're talking about in the classroom setting in a real life situation. This particular theatre and education is really, really interactive in that the young people also get to ask the cast questions after the show as the cast still appear in character, so they can really dig behind some of the stories and gain some further information and signposting. Some of the other advice we've given to schools as part of this package, and you'll find in this toolkit, is some advice around obviously having really well-trained teachers that feel confident and comfortable to deliver the subject. When we speak to our young people regularly across the county, what they really value in terms of their learning experience is kind of not a bolt on to another teacher's job, but teachers that feel really skilled, really confident, and have received training. As it says on the slides, there are developmental programs. So we obviously advocate a spiral approach where we build on themes year on year. So you're not always introducing new content, you're taking content to a higher level as the children get older. But obviously make it contextual for your school cohort, which might vary according to town or part of your borough or county. Some of the other information on the slide shown is other information advice we give to our schools. We're really lucky that we have a PSHE hub that we can support our schools in within this county, but just ensuring that curriculum is inclusive, it's culturally relevant, as I've said, not only to your setting, but also gives the broader experience of young people across the country. So, for example, if you are that small village school or you live in a city, you're giving that broad range of experiences to your young people, should they move on kind of in their future lives. Really making sure that information you're giving is based in kind of grounded research from credible sources such as public health or NHS or big reputable research programs, as opposed to anecdotally pulling down statistics from maybe less well thought of websites or certain aspects of social media, which might not be grounded in fact and the preventative health approaches that we want to give our young people. Some really, really clear on is avoiding those scare tactics. So not to normalise substance misuse. So, for example, instead of saying that, 5% of young people use cannabis, we'd say that 95% of young people don't use cannabis to help normalise those more healthy behaviours. That isn't a true statistic, by the way, that was just an example. And then how we're engaging with our wider community. So whether we're giving information to our parents and carers in our settings to help them continue the conversations at home. We want to inform them that young people are going through this education experience, but how can we empower our communities to be having these conversations outside of the classroom as well? And then probably the hardest thing within PSHE in terms of schools and education is how we monitor and evaluate the impact. So, we absolutely don't advocate sitting your young people down in an exam style type thing, because it's about their skills, confidence and understanding. But at the same time, we need some tangible data to ensure that our young people have progressed with their knowledge and their confidence, and also to ensure that kind of any bits that they weren't clear on or maybe have got some wrong information on, that we can address those misconceptions and ensure they go away with the right information. I hope that helps, Ruth, and if there's anything more, please let me know.
Yeah, well, I think we were hoping that you would talk us through a bit of the detail of the intervention that was delivered in spring, so around drugs, alcohol, and tobacco. If we
yeah, absolutely, yeah, of course. So, so we provided a series of lessons and the theatre and education. So the lessons looked at a wide range of themes, certainly around drugs, alcohol, vaping, and tobacco. And we kind of recommended some core elements of those lessons to ensure that schools were delivering those topic areas that were going to be brought up in the theatre and education production, And then we kind of added some additional information bits on there according to their context. So, you know, we looked at the wider issues around drug use, and then we gave some specific indicators around cannabis, around some of the other substances that could be prevalent amongst young people. Vaping was a #1 request from our schools around learning and information. So we put lots in around that. We liaise with our substance misuse service as well to see what local drugs and issues were coming up amongst our young people in their referral services. So we were able to include some really locally based intelligence around the potential harms of spice being included in vapes. So that was included in the lessons to ensure that our young people kind of had that information. And then, you know, our kind of standard approach around tobacco, reducing tobacco use if young people are using it, obviously advocating it for not smoking, and then signposting to cessation services should young people be using tobacco. And then kind of to summarize all that picture is actually from my school. So it's really nice to see that one. So kind of we were lucky that ours came in probably about 4 lessons into the project. So we delivered the lessons. The young people had a really good understanding and really good grounding. We've been through the ground rules. They understood kind of our approach to learning around drugs, alcohol and tobacco. And then they were able to get this session, which was an hour in the hall. Our 240 of our year 9s were listening intently, which that picture proves, which is quite handy, to the really good storyline that was put on. And there's information around this in the toolkit, but this particular theatre education was around drug use and how some young people had kind of got into substances as a means to cope. There was some peer pressure in there, and then other associated issues that our young people could kind of see it in a real life context about how people could potentially fall foul of substance misuse to deal with other stresses and issues in their life. And really, really importantly, at the end of the play, where they could seek help and advice and support from. And then we were really fortunate where a sequence that we then had another couple of lessons as a follow-up to explore those details in a bit more depth. And then, of course, that really important signposting for our young people about where they could access support in school and outside of school.
Thank you. I think I failed to click us through to the next slide that outlines some of the detail of the play, but you've really
oh, there we go.
Yeah, so there are the actors who you met at Seaford. But yeah, I think you've sort of talked us through that, haven't you?
Yeah, a fairly normal, you know, not an overly dramatized version of potentially what could happen. Obviously, you know, there needs to be some kind of artistic license to compress it into an hour for young people to see. But, you know, feedback from young people wasn't that this was out of the ordinary and couldn't possibly happen to a young person ever. And, you know, it was really unrealistic. The actors worked really closely with young people in the company, worked with our groups to really make sure that the storylines were realistic. And the substances that the young people were exposed to were potentially ones that they could be exposed to in their setting, as opposed to kind of these, you know, very difficult, maybe very harmful substances at the Class A end that young people hopefully are not exposed to. They looked at kind of alcohol use and vaping more than other things that just wouldn't resonate with them, so wouldn't be appropriate.
Thanks so much, Sam. And we'll hopefully come back to you in the Q&A. We're going to turn to David again to tell us a bit more about, or to pick up on what, Sam, you were saying about the importance of monitoring and evaluating these packages. So, David, could you tell us about the research that has supported the development of the guide, please?
Yeah, so over the last few years, we've been doing our own internal evaluations of the programme, but really wanted to explore something a bit more in depth. And this opportunity came up to apply to the National Institute for Health and Care Research Innovation Fund to reduce demand for illicit substances. So we jumped at that chance. So overall, it's a call of about £5 million focused on implementing and further evaluating interventions that have shown evidence of effectiveness and positive impact on the reduction and prevention and demand of so-called recreational drugs. Essentially, what can we do to find out how to stop uptake of drugs among young people? And that's what we focused on was the 11 to 15-year-old cohort, really looking at primary prevention and this theatre and education intervention itself. So yeah, we really wanted to kind of explore in more detail using various different methods how we could find out whether it worked and give us a basis for doing more of this work as well, justifying future funding as well.
You've got another slide with some of the details here.
Yeah, so the particular name of our the title of our research was Preventing Illicit Substance Use, a Mixed Methods Evaluation of a Schools-Based Theatre and Education Intervention. We partnered up with our kind of key partner in this, jointly led bid with the University of Brighton. That's why we've got Jörg and Carmen here to talk through kind of the methodology and the findings of that research as well, but collaborated with a lot of other partners, including Brighton and Sussex Medical School and the University of Kent. The key provider partner, I guess you could call it, it's Solomon Theatre Company, who's actually the ones delivering this particular performance, because we don't always use the same theatre provider. We kind of seek out the topic of interest and see what's out there to best suit what we want to achieve. And the last partner listed there is Unity Insights, who supported us with the cost-benefit analysis, so the economic potential savings or not that could arise from delivering this intervention. Yeah, and obviously I think the description there says we focused on 12 to 14-year-olds, delivered a multi-component programme and evaluated it essentially as part of PSHE.
Great, and I think Carmen is going to tell us a bit more about how then that research was planned and how it involved young people. Carmen.
Okay, thanks, Ruth. So yeah, when we were planning the research, our aim was not just to understand whether or not the theatre and education programme worked, but also how it worked, for who it works for, and under what conditions it can make a difference. So we kind of designed the evaluation around 5 main kind of objectives. So first, obviously, we wanted to know, does it work? Does it have the potential to prevent or delay substance use in young people? But we also wanted to understand how pupils, teachers, parents and carers actually experienced and interpreted the intervention. Also, we wanted to know kind of what contextual factors might impact how the intervention is experienced. So, different schools are or different areas, and also young people are all bringing their own experiences and different backgrounds in as well. So kind of understanding some of those to kind of see, what contextual factors kind of have an impact on how it's received. We also wanted to know if it was good value for money, so to understand if down the road it can reduce kind of costs in other places. So we did one of our partners did a cost benefit analysis, and also we wanted to know whether the intervention reaches all groups fairly. So whether, different groups are receiving it differently, and, kind of whether, how we can adapt things to ensure that the intervention is kind of, received by everybody. So the planning phase really was about building a mixed methods design that could really answer all of those questions in a joined up way. I'll go to the next slide, please, Ruth. Thank you. So young people were involved throughout the whole process. So we met with them before actually running the intervention. They had input on this early script. So they watched a recording of the performance before we ran the intervention, changed some things to kind of make it more relevant, the language, the substances that were used by the performers, to really kind of make it reflect their lived experience. They also had a lot of input on the questions that we asked when we collected the data through the survey, and also some of the topics that we covered during focus groups during data collection. Once we'd kind of collected all the data and we had some emerging findings, we also sense checked it with the group of young people, just to kind of again check that, you know, we're not missing anything and that, you know, they agree with kind of the conclusions that we were making. And you'll see in a minute as well, they also helped us with dissemination. So there's a lovely video that really kind of, bring in their voice, kind of discusses their kind of involvement in the project. So yeah, it was really useful to us having that kind of group throughout the project to really kind of guide a lot of areas of the project and making sure that it kind of really was youth focused, but also they also reported to us that a lot of them had a very positive experience being part of that group as well, and kind of really feeling like they were making a difference to the project. Yeah, pass back to you, Liv.
Oh, thanks. Well, we're gonna hear directly from some of those young people within this film now. Hopefully this all clicks through for you. It's just about 3 minutes long, I think.
1 in 4 14 to 16-year-olds in East Sussex have tried a recreational drug. So, the research team have been working with us, our parents and professionals to find out how to reduce or even prevent recreational drug use in young people.
The idea was that we would have an intervention based on a theatre play.
You're not listening.
Hey Mum, I was watching something.
Yeah? Well, I don't care.
So we wanted to build a more comprehensive wraparound programme with curriculum support before and after the theatre and education performance.
Our involvement in the project primarily was to convene a sort of a solid group of young people or groups of young people from across East Sussex, and then really to help shape the content of how the theatre and education project would work.
So the youth advisory group met several times from the beginning of the academic year, and they watched the show, they watched the old previous version.
Then we had a process of going through how we can change it, make it better from obviously a student's voice.
They said that the performance works best when storylines are authentic, the messaging is non-judgmental, and when they felt they could relate to the characters.
And now in the new one, they've replaced the cigarettes with vapes, and more alcohol has been used in it, and the music has been updated to what the kids these days listen to.
So our findings found that teachers and pupils really enjoyed the performance.
Lucy, what's this? These drugs, are you mad?
Staff really enjoyed the resources, so the lessons, and said that it really opened up conversations after the performance that wouldn't normally happen. Our analysis also found that it was good value for money, mainly through potential benefits in reducing unemployment and youth violence in the future. We've also developed resources available on the East Sussex County Council website that can help others design and deliver their own theatre in education project. So this is really important to get right. Everyone benefits from getting it right for young people. It's not just about prevention now, it's also about building a healthy, stronger society for the future.
So, excuse me while I try and get us back to the presentation. I think we're going to come to you now, Jörg, to tell us more about how the research was conducted and what you've learned.
Right, thanks, Ruth. I hope everybody can hear me all right. So what we did was a mixed method study where we had a survey prior to the intervention and post-intervention, i.e. after the intervention. We used realist-informed evaluation, so that is what Carmen will tell us more about a little bit later. And it's basically about what works for whom and in what context. So these are the That's the mantra of realist evaluation. And we had, again, as Carmen already alluded to in the film, we carried out cost-benefit analysis led by Unity Insights, which is a limited company working in our region. We had these quantitative and qualitative elements, as I said before, and we also had carried out interviews with teachers and some with parents and carers. We also finally had a teacher survey. So it was very comprehensive and complex data collection. Basically, our pupils were in years 8 to 10, 12 to 15 years old, and school staff were involved in the delivery of actually essential to running it. Overall, there were 24 schools involved, and we had 5 schools with a deep dive where we studied in more detail what happened, how the play was perceived, and also more generally the package making up the intervention. Next slide, please. So these are very selective findings, and it is a complex picture that emerges, which is not completely aligned and is still causing conversations amongst the team, which is not fully aligned with the qualitative findings. So first, we need to be mindful that the group of children we look at, the pupils 12 to 15 years old, are at a very rapid stage of development. That means things are changing quickly. And for example, in between the baseline data and the post-intervention data, just to give also an indication of the scale of the problem at that stage, is that only 12 children reported to have taken drugs. So I note this is all self-reported data. It's not from the police, or it's not objectively verified in any way. So 12 reported to have used drugs at least once. And at the post-intervention, sort of a month later, it was 18. So that's a 50% increase, which sounds a huge number, but it's only 6 out of, dependent how we look at our data, between 800 and 1,400 children. So again, that's complex and cannot be elaborated in too much detail here. Small numbers, but there is an increase. And overall, it's a really complex pattern in the self-reported data. And I will say a little bit more about this. So we found our findings were perhaps not exactly what we hoped for. There is actually a reduction in self-reported knowledge, in self-reported reduced refusal efficacy, but also a reduction in the likelihood to use drugs in the future. Why do we find this in contrast to the very positive findings which Carmen will report later on? It may be possible that the children undergoing the education, receiving the package of intervention, actually realized that they knew less than they originally thought they know, that they adjust their estimation of how likely they are to take drugs or to refuse drugs. So it's really complex. When we then looked at the degree to which the intervention package was implemented in different schools, there was quite a big variation. Some schools really used the materials we provided. They had classroom sessions, whereas others, it was mostly the play and a bit of conversation or discussion, teaching before or after, but very limited. We then see that those who received the intervention more fully showed increased knowledge, stronger refusal efficacy, but also greater likelihood to try drugs, the latter only weakly significant. Again, complex, and there will be a final comment towards the end of my part. Based on the data we have, there's nevertheless a 20-year expected economic benefit. So it's a long way down the road of £3.10 for every pound spent after adjusting for age and trends. This finding has to be seen in the context of this rapid change of which children undergo at that age. Given the complexity of our findings, of these quantitative findings, we would now definitely have a control group, which we didn't have. So if you want, it's technically called a one-armed trial. With a control group, we could account more clearly for what is the impact of the theatre performance and the associated classroom activities compared to those who would not receive that, who would undergo teaching as usual. So that would be a plan for the future. So with that note, I will stop and hand back to Ruth.
Thanks, Jörg. And I will hand to Carmen again to tell us about the qualitative findings and how overall this has informed the guide. Carmen.
Yeah, so the qualitative findings kind of helped us have a bit more nuance and understand kind of how and in what situations the theatre performance might work in practice. So it kind of gave us some guidance for the guide on what needs to be in place to help pupils engage with the performance meaningfully and kind of things that can tip the balance. So we have like this early program theory that came from the qualitative data. So you see, it's not just about kind of the performance, but it's also kind of thinking about what happens before the performance and how we set that up. So from the qualitative data, we found, that it being relevant and authentic was really, really important to young people. So the guide kind of recommends that we should be talking to young people before and making sure that it kind of really reflects their lived experience was incredibly important. There's also some practical things such as setting up the space, ensuring that, the comfort and that everybody can kind of see well, and also thinking about how it fits into the curriculum and the different backgrounds of young people coming into the room. So young people are coming in with existing knowledge and different experiences and stuff, and that's kind of really important to think about when designing a theatre and education performance to ensure that it's broad so that it kind of can reach as many young people as possible. From the qualitative data, we got a bit of an idea as well about what's happening when young people are watching the performance. So the live theatre can grab their attention. They might think, is this relevant to me? And kind of start identifying with the characters and kind of feeling an emotional reaction, which can lead to some reflection on kind of their own behaviours or start thinking about some of their own relationships. And we also found, which kind of ties into the quantitative work as well that Jörg just spoke about, is that importance of consolidation. And kind of we found from the qualitative data some of the barriers associated with that and some kind of recommendations on how that can be improved to make sure that young people are kind of getting that time after, and we're bringing kind of parents in and kind of making sure that they have places to go for support after. So there is a more detailed version of this program theory in the guide, which kind of gives an overview of kind of all the things that we found from the qualitative data, which can be used to kind of start thinking about implementing, other theatre and education projects. Next slide, please, Ruth. So from the qualitative data, we also found there's these kind of balancing acts that kind of need to be thought about when delivering a theatre and education project. So first, I've selected a couple here. But firstly, there were big differences between how teachers and young people perceive help seeking. So adults very often think that young people, know where they can get help and that that's available for them. But pupils really need to be able to see that and believe that that is a realistic option for them. So this feeds into one of our do's in the guide for our features for impact on kind of making making sure that the performance has the biggest impact possible, is really kind of modeling those help-seeking behaviours and making sure that they're realistic for young people. There were also differences in how young people perceived the humour in the performance. So it was kind of the thing that young people remembered the most and spoke about the most after, and that's what really kind of engaged them. So humour is incredibly important to keep a performance engaging, but it needs to kind of make sure that it's not tipping into embarrassing anyone or kind of singling anyone out, because that can start to make some people feel kind of uncomfortable during the performance. So that's one of our do's in the guide, is to kind of really make sure that humour is used appropriately during the performance. And also another thing that came up is the balance between showing realistic consequences that are believable, but also having balanced messaging. So young people really wanted to kind of see, wanted it to be real. They wanted the parent to react in a way that they felt was believable, and they wanted to kind of, see more of what happens, but also they don't want to be lectured, and we don't want to be kind of using shock tactics, or kind of, preaching to them, because that's when young people can just kind of switch off. So we have in the guide, making sure that it's believable, realistic, but we also have a do not for, avoiding shock tactics in this kind of intervention. Next slide, please, Ruth. So just to kind of sum up some of the key research findings. So using a performance as part of a wider package can be really useful to help young people kind of reflect on their own behaviours and their own relationships. But what's particularly important is following that up. So it can't just be kind of a standalone thing. For it to actually have any kind of benefit, it needs to be kind of talked about and, thought about after. And it is a really good opportunity. A lot of teachers talked about that it's a really nice way to kind of bring up these conversations of young people, rather than kind of just jumping on them from nowhere to talk to them about, drugs and substance use. Having that to kind of start those conversations was a really helpful tool, and ensuring that teachers and adults have the time to be able to do that is a really important part of making this intervention work. So through our realist evaluation, so looking at, what kind of works and for who and in which contexts, that kind of gave us that program theory, which can be a starting point for other commissioners or schools to kind of be thinking about how best to implement this kind of theatre and education intervention. And as Jörg mentioned, we also have the cost benefit analysis that found kind of some potential economic benefits down the line, with lower substance use being associated with, reductions in youth violence and future unemployment. So so the guide really is kind of a practical, provides some of these practical recommendations that have come from some of this data. Hand back to you. Thanks, Ruth.
Thanks, Carmen. And we've got a slide to provide people with the link there to the web page where they can download that guide. That's the end of our kind of Q&A presentations section. I can't see any questions in the chat so far, but if anyone would like to ask a question, you can raise your hand and then I'll be able to unmute you. While we wait, I have some handily pre-prepared questions to kick us off. So perhaps, Sam, I can come back to you and ask, obviously there was new RSHE guidance issued this summer. Can you tell us whether that sort of supports the use of theatre in education, or does it change it in any way?
I would say it kind of supports the whole package. So our toolkit in terms of the lessons and the theatre and education complementing the experiences for young people. I know we've spoken quite a lot, specifically around drugs, alcohol, and tobacco education, because that was the theme of this particular theatre and education. But as David mentioned, we've also run a very similar kind of programme in terms of its scope and its outline around harmful sexual behaviours. So looking at the new RSHE guidance, there is inclusion to specific learning around vaping, which obviously we had already included in our lesson package and our theatre and education, and then kind of looking at the increased focus on violence against women and girls, consent, indecent images, keeping safe online. That links quite closely to kind of exactly the same model that we've used, but obviously we've swapped out the theatre and education to explore a coercive, harmful sexual relationship, and then also the associated lessons that go with that in terms of consent, sharing of indecent images, healthy relationships, staying safe online. So in terms of a package, if schools are delivering this as part, and I really need to emphasize part of their spiral curriculum for secondary year 7 and upwards, absolutely it complements, and there'll just be a few more additions to come in line with the new guidance. In terms of an approach and a model as well, there's quite a heavy emphasis on the assessment tools in regards to checking young people's knowledge and understanding, which is being made more predominant in the new guidance. And really, really importantly, young people's consultation and young people's voice in planning the lessons to ensure that they are appropriate for their needs, and making sure that the theatre education covers the issues that they need to talk about within their context. So it absolutely does. I would say kind of what we've delivered already does it, and if it's replicated with the new tweaks to the new criteria, then absolutely fully support the new guidance.
Great, thank you. I see there's a question from Liz, so I'm going to allow mic and camera. I think you'll still have to unmute yourself though, Liz, to ask your question. And then we've got a question in the chat from Fiona that we might come to afterwards.
Hi there. You may have touched on this, but just sort of the scope really. The schools that have been included. So I think my understanding is it's pretty comprehensive across the whole of East Sussex. That going forward, we've actually got a really high level of uptake for this, the next scheduled activity. That reception, yeah. Sorry, it's pretty of a simple question, but and when the programme of work is launching.
Yeah, shall I take this one? Probably that might be the easiest to answer. So yeah, with our county in terms of East Sussex, we have about 25 secondary schools, and every one of those took part in the project to an extent. I believe it's 24 out of 25 had the theatre and education. Working with the company and with some other our specialist settings, there were kind of more bespoke lesson delivery and workshops in some of our specialist settings as well. Yeah. Although the resources we provided were for standard mainstream lessons with some guidance on how they could be adapted for specialist SEND settings, we didn't provide SEND adaptations because every setting is so specific, but we did work with colleagues and supported them to adapt according to the needs of their children and young people. So I think we kind of are around 5,000 or 6,000 young people every time we roll these projects out. In East Sussex, which is a really high percentage of our pupil cohort.
Yeah, I think it's just recognising that it's really impactful in terms of volume. Yeah. Thank you.
And Fiona's question is sort of follows on from that around had the schools commissioned theatre and education before? Was it already embedded in practice? And then refinements brought in. David, perhaps you could respond to that one.
So we've since about 2019, we've offered schools the opportunity to take up this intervention and have theatre and education performances within their schools. This particular performance that the guide is based on, we had delivered on one previous occasion in East Sussex and done our own internal council evaluation of how it went and pointers for improvement. and the NIHR funded research enabled us to really dig into the depth of that, prepare really well for the changes by engaging with young people more around what could be improved before it was delivered for that second time. And the other question around the year group, it was the vast majority of pupils receiving the theatre and education performance were our year 9. So, but we very much leave it to the school to decide the exact year group that they think it's most appropriate to. So recommend year 9, but some chose to show with year 8 instead.
In the absence of other hands raised, maybe I could ask you to say something, David, about what changes the council is making to the theatre and education programme based on the research findings and the guidance.
So I think it provided lots of valuable pointers, especially all of the kind of qualitative aspects that Carmen talked us through in terms of how we need to prepare schools and give them enough time to be able to set up the theatre and education performance in the right way, and have enough time afterwards to be able to incorporate a Q&A section that it can be included, where due to timetabling 50-minute lessons weren't enough. They could have been kind of cut off slightly, not delivered in the best way possible. So there's one around timing. There's also around the fact that if we were going to kind of introduce a completely new theme or topic and look for an alternative performance by a different theatre education provider, we'd want to have lots of discussion with them, lots of looking into the exact, we always view a recording of the performance before we choose to go forward with it, but we probably do a lot more work with young people as well before that to make sure that we could work with that provider to tailor it to exactly our local needs.
Thank you. And maybe one last question from me to Jörg and Carmen. What else will you be doing to kind of share this research and what's been learned beyond this guide?
I could come in. Yes, so we have published, or we are in the process of publishing a protocol paper to sort of report what exactly was done. And Carmen may want to comment on this, has written a paper on her work around the realist evaluation. And we are also publishing a paper on the quantitative results. So it's quite a comprehensive approach. We also will write a blog on the university website about the project as a whole. Carmen, do you want to add something?
No, I think you covered it. So the papers almost one's submitted, and as Jörg said, we are in the process of the other two. So
great. Well, as someone who's been involved, I'd also say you've learned so much about kind of working with schools, haven't you? So it's not just the results that we're sort of sharing here and in the guide, but all that you've learned about working through the process of this project. That's really valuable to share. Okay, I can't see any more questions from our audience. Thank you for the congratulations from Karen. So all that is left to say is thank you to my colleagues that have joined us, the speakers today, and to acknowledge, if I can get to the slide, acknowledge all those people that have made this possible. So not least the Young People's Advisory Group, the pupils who actually took part in the research, the teachers and school staff who facilitated that, as well as parents and carers who facilitated that. Thank you, of course, to the NIHR for the funding to conduct the research. And if anyone on this call wishes to get in touch to learn more or get to follow up, then the details for Jörg and David are on the screen now. But yes, please do have a look through the guide that is up there, and any other sort of links to publications and things will be shared in due course on the same page.